As many of you are aware, the coronavirus is making its way all around the world. Are you one of those people that are afraid to catch it, or are you one of those people that are pretending as if it does not exist? Today, I'm going to discuss the importance of self-quarantine and social distancing. There are three main points I'd like to make. There are factors that are still unknown, there's a chance you could be putting others at risk, and it could result in death. It is very important during this time to make sure you're safe and taking precautions to prevent yourself and others around you from catching the virus. If you're experiencing fever, cough, shortness of breath, chills, muscle pain, headache, sore throat, or new loss of taste or smell, you may want to get tested. The symptoms may appear 2 to 14 days after exposure. One of the reasons it's so important to protect yourselves from this virus is because many things about it are still unknown. It is better to be safe than sorry. Scientists are still unsure if climate impacts the severity of the virus. They have found some ways in which it can travel, but there are many possibilities of other ways in which it can be passed on. The CDC believe it can be spread through close contact with other people, from respiratory droplets that become airborne when someone who is infected sneezes or coughs nearby, and finally from touching our mouth, nose, or eyes after touching a surface that has a virus on it. My second point is that another problem during this pandemic is the risk of putting others at risk. If you choose to leave your house to go to the store, for example, it is very important you wear a face mask. When in a grocery store, it can be difficult to social distance if you are standing in a checkout line. The CDC states it is important to wear a mask to slow the spread of the virus. This is for your safety and others. If you have friends or family that have a compromised immune system, if they have cancer, kidney disease, liver disease, or serious heart conditions, if they're above the age of 65, or in a nursing home, they are more likely to catch this virus. Also, pregnant people and anyone with a disability. So if you're not concerned for your own well-being, be concerned for those that are close to you. Finally, if I've not yet persuaded you to keep distance from others and staying safe, I would like to make my final point that many people have lost their lives due to corona. Most people seem to think that older people of older age are going to pass away from catching this. However, at this point in time, on record, there have been people of all ages that have lost their lives due to the virus. There are currently 170,000 deaths worldwide, and in the U.S. alone, there are a little over 45,000 deaths. Death ages range from 0 to 75 and above. Not all have underlying conditions. Some solely died due to this virus. In order to lower the risk of catching the virus and decrease the chances of spreading it to others, resulting in possible death, we should continue to stay inside and distance from other people in public places. Many states that have chosen to shut down right away have less cases than the states that were not as quick to take action to contain the virus. I'm aware many people do not think this virus is real or feel that it was purposely created. Whatever your theory may be, there is evidence that is taking people out, so maybe it is best to acknowledge that no one is safe from catching it. For those of you that want to know more, I encourage you to go to cdc.gov to learn about how to take further action. How much higher do the numbers have to rise before people realize this is real and it needs to be taken seriously? Will you increase awareness for those that do not watch the news, or will you go out as if there is no pandemic? Thank you for listening.